Hey there. Welcome to Alive inside the Radiantly Alive Woman. It's very nice to be with you here on a Saturday late afternoon. It is nearly sunset, or the sun is coming down here in beautiful Costa Rica. And I wanted to come live today to talk about a topic that a lot of women have asked me. They usually private message me this question because it can be a very personal, also very emotional topic to kind of explore. So I wanted to make a live about this, about IVF treatment and how it could be affecting your well-being. So we're going to dive into this topic over the next few minutes and always into these three different areas. All of my videos in the SCAR series, which is coming to an end, we're actually near the very end, and then we're going to switch themes. But this SCAR series has information in three different sections in these videos. You'll always hear me talking about the things that you may be experiencing physically because of this type of scar. In this case, we're talking about like puncture wounds from the IVF treatment. Once we get a good handle on that and we can see that more clearly, it's usually easier to talk about the physical first because, it's right in front of us, it's very tangible. We're usually referencing it when we're kind of talking about our own well-being. It's more accessible. We probably feel a little bit more related to our physical. Once we gather that, then we want to talk about the energy and the emotion. What could be going on in our, energy in our emotional field related to IVF? And this is obviously a really important topic when we are discussing IVF treatment. And then finally, the third and last part in these videos is the what to do. It's really important that you get the education and the knowledge that's required to move forward. And then once you have that information, you want to have something to start enacting, to start really taking the process forward. So a lot of online stuff doesn't have this. It usually gives you all the goods, like all the wisdom, but kind of leaves you hanging at the end. And I want to give you something that you can do, something that you can apply today. If you have IVF treatment or have had it done, and you're really resonating with a lot of the stuff that I'm talking about as far as the physical things, the energy, and the emotion, then you can take this thing that we're going to talk about at the end of the video and apply that today. It's really important to me, and I'm glad that I can offer that in this way in this community group. If you know someone else who has had IVF treatment and you would like to share this video with them, please invite them into this Facebook group. Every woman who's in the Radiantly Alive Woman Facebook community can invite their girlfriends, their family friends, their colleagues, as long as they're women. Please feel free to invite them in here. It's so important that we all have this education as well as this applicational kind of wisdom that we can move forward with together. That's why I made this group, and I'm really happy that we are all in here and continuing to grow. Okay, so let's talk about IVF treatment. Let me just get my notes pulled up. Get the goods pulled up. So let's talk about what happens to the body when this is going on. It's a huge topic, and I know that before you have the IVF treatment, like before you make the decision, as well as during the whole process, you know a lot about the hormonal effects and some of the side effects or some of the things that may be going on in your body. So I don't want to touch on that because I think that is a more obvious thing. What I want to touch on more is if we talk about the physical considerations that happen to our body because of the IVF treatment, as well as the emotion. I'm always talking about these two, but in this circumstance, as you may feel in yourself, the emotion and the energy is like more highly rated compared to the physical. So a lot of the time we're talking about scars that take up a lot of residence on the body, like a hysterectomy scar, breast surgeries, surgeries from organ removal or cancers, and they're usually a lot bigger in size. Now, the IVF treatment is more like these tiny little puncture wounds, but they're happening quite frequently, and the kind of feeling, the energetic kind of signature or the emotion around the event can be very intense. It can be very overwhelming. The process is a struggle. And I know this from working with so many different women. I know each woman has their own unique kind of IVF journey, and there are always ups and downs in the whole process. But the kind of general vibe, especially if you've gone through it many different times, there's a lot of anxiety, a lot of stress, a lot of emotions that are just kind of bubbling up very frequently. So in this case, the IVF treatment really takes a higher priority in the emotional area rather than the puncture wounds. However, if you've seen some of my other videos, I spoke about the effect that cortisone injections could have in the low back, and those are also puncture wounds. So we don't want to make the assumption that just because the scar is not large, that it doesn't matter. As you've probably heard me say a bunch of different times, all scars matter, and every single scar has a story. So if the story is not very weighted, like say you just cut your finger cutting vegetables and having dinner because for one moment you were distracted, that probably isn't weighing very heavily physically because it's not in the area of really high significance, which is anywhere from the head to the pelvic floor. But it's very likely that there's not a lot of emotion kind of trapped in that. There very well could be a lot of emotion trapped up in that, but oftentimes it's not. It's just usually a little accident and then it's kind of over. However, if you were like not paying attention to cutting vegetables because you were ruminating and you're angry and you're resentful and you're thinking about someone or a story, that's kind of a whole different sphere. But the thing I want to get across here is the puncture wounds are in the midline and they happen at quite an intense frequency, and the emotional kind of challenge can be huge. So let's talk about the emotions second. Let's go into the physical considerations. So I have a few stuff here that I want to talk about. Most importantly is the pressure problem that it could be creating on your body. So anytime you have scars, physical scars, including the puncture wounds, on your torso, particularly from your rib cage down the front of the abdomen to the pelvic floor, basically your whole pelvic floor to your tailbone, if you have scarring there, then we already know that you have a pressure problem in the body. So let me explain what a pressure problem is. Let me just try to clarify this so you can all kind of see once I explain this party balloon thing to you. It's very easy to understand. So I like to talk about problems like symptoms and challenges that we have in really simple terms. So a pressure problem is this challenge that the whole body will experience because of scarring on the abdomen. So this party balloon I want you to visualize is the diaphragm on top. Then you have the complementary pelvic floor on the bottom. Then you have your abdomen and you have the sides of your body. And then you also have the back of your body. So really you have this intrinsic core that is like a party balloon. Now, when you have scarring there, like for example, a bunch of little puncture wounds, as we're talking about with IVF treatment, imagine that party balloon has a lot of weakening spots, particularly in the area where you're delivering the treatment into the abdomen. So this creates an instability, not just local where the puncture wounds have been happening, like where the puncture sites are, but it disturbs the whole of the party balloon because it's an intrinsic closed system. So an intrinsic core, intrinsic system, it has a bunch of different names, and we talk about it in stuff like Pilates. We also talk about it in stuff like Olympic weightlifting. It's required that we have a certain type of pressure in our body, particularly in our abdomen, in the exact same way that we require a certain amount of pressure gradient and change in our lungs just from taking a breath. That's how we breathe, is a pressure gradient. So when this is disturbed, some of the things that you could be feeling when you have a pressure problem in your body is, let's just talk about physically for a second. You may have challenges with your digestion because inside this party balloon is all of your digestive system, your urinary system, and of course your entire reproductive system as a woman. It's all inside that party balloon. So you're going to be having potentially, just let me know if this resonates or not, but you'll have digestive issues. You may have food intolerances, challenges digesting things, slow digestion, fast digestion, aka problems with your bowels. You may experience inflammation, distension, bloating, all because of the pressure problem. This may also feel or come off as incontinence because when we're talking about the party balloon, we got to think about the bottom. We got to think about the bladder and bowel function. And then on top of that, if you have a vulnerability in that balloon, it's going to challenge your stabilizing feeling, the feeling of stability that you should feel in your core. You know, when people say I have a strong core or a weak core, what they're actually talking about is not like if they have like an 8-pack or not, but that sense of like adaptability and like resilience in their core to keep them feeling stable. So when they go reach for their purse or they'll go reach up high or they reach behind them, they don't have that like naggy vulnerability kind of, ooh, it might like throw my back out kind of feeling, like it's going to spasm. That's a really common thing that we all feel when we have pressure problems local in the area. So that's the party balloon with the IVF kind of punctures, but the pressure problem is actually systemic. So a lot of things when we have pressure problems, you'll feel it in your face because when the pressure's off somewhere, you'll feel it elsewhere. So you may feel like congestion in your face, sinuses, um, seasonal allergies, pressure headaches, all of these types of things are also very common. Another type of pressure problem that you may not associate with pressure, but is when we have joints, particularly the hips, that are incredibly tight. So if the pressure gradient is not correct inside the joint capsule, especially of neighboring large joints like the hip joints, they're massive, you may feel a challenge there. Now, the other thing that I want to talk about with pressure problems is the obvious one that is going to be a challenge with your breathing. When you have a pressure problem, you will be breathing in a challenged way. Now, you may not feel that you have a breathing problem. Most people don't really connect the dots that they have like a breathing dysfunction is really the proper term. I don't like that word dysfunction because it makes you feel like you're stuck with it. It makes you feel kind of badly that you have this dysfunction in your body. That's not how I want you to think about it because you can resolve these things really quickly by working on the scars. So the breathing will be challenged. What will you feel? You may not feel anything physically, but you'll definitely feel the kind of emotional or energetic qualities of breathing problems. So you may have brain fog. Obviously, just like general malaise or like sluggishness or challenge to like get up and moving in the day, especially if you mouth breathe. And mouth breathers will often will often have pressure problems. So these are things I want you to think about, as well as your kind of when you're feeling that like reactivity and that emotionality coming on, it quickly escalates to like anxiety and stress. You can go from like 0 quickly to 100 because you don't have the tools or the access to regulate your nervous system through your breathing mechanics because that balloon is challenged in some way. And it's could be just as much challenge with the puncture wounds as a larger scar, like I was saying before. So that's in a little, we just dipped into the emotion and the energy for a second. So let's just come back up and talk right back in the physical again for a moment and talk about the hormonal challenges that you may be experiencing and some of the common like symptoms that's going on with IVF in the physical. So obviously, if you are kind of playing with, you're orchestrating some sort of hormonal experience, that's a systemic problem that is going on in your body. When your hormones are doing something, everything else is accommodating and trying to like work around that. So that's really overwhelming for the body. So you may feel very tired, overwhelmed, problem sleeping. All of these things are something that you may be experiencing when you're going through IVF treatment, obviously during, but there could be a prolonged kind of after effect of that as well. And then of the fluids. So you may have a fluid problem during the treatment as well as after, meaning inflammation, swelling, distension, like holding on to fluid. It could be something like you notice it after sitting at your desk, or just seated for a long period of time. You notice that your feet are swelling and swollen, and that didn't used to happen. Or it could be something more like, you always just feel like you're holding weight, like fluid. I worked with someone who had IVF treatment, and she had put on something like 10 kilos of extra fluid in her body, everywhere from the scarring down. That was really challenging, obviously. So that was something that we had to work with. So these are the physical things that I want you to just recognize in yourself. These are common things that I see and that I talk about with women in general, because I'm just generally speaking about IVF treatment. There's so much like personalization that goes into it because every woman has a different story, like I said, and also every woman has a different set of circumstances. So if you are already challenged, like say you already have scarring, on your spine, on your abdomen, breast area, armpit, chest, throat, head, then you may experience more symptoms or a kind of an increased rate or an increased severity of the symptoms that I had mentioned. So that would be interesting to look at for yourself as well. Now, if we dip into the energy in the emotion, which is the second part of all of these videos in the SCAR series, I think we're getting close to 40. The emotional is always a little bit more challenging to talk about because it's a little bit more abstract. So what I want you to really do in this section of this video is think about your own story if it feels okay and comfortable to do so. The emotional kind of charge or energy around these kind of circumstances can be incredibly overwhelming. So I want to just put that out there. If it feels really hard, I want that to be, rather than something that crumples you inward and kind of suffocates you, know that you have a really beautiful opportunity to transform a lot of that. Because if it feels really raw and tender, it's not a bad thing. It's actually the recognition that you have something real to work with. Do you know how many people come into my office and say, I don't know what's going on, I don't know what I'm feeling, and I don't know when it started, but I feel horrible. Can you please help me? That is the general kind of like conversation starters that I have with people. And it's just, at first it was really a struggle for me. So I'm like, how are we going to get through all of this? This is a challenge. But for people who have IVF treatment done and you feel that rawness right away, it feels like you're kind of like it's right on the surface, like it's very superficial, like right in your throat kind of thing. That means you have a great potential to already start working with something that's already there. Because when I work with people, most people are really confused about their wellness. They're really confused about where things started, which creates so much distrust in the body, which is a really big problem for IVF people who've had IVF treatment. There's a lot of lack of confidence. It's almost like there's this fragmented connection with ourselves, and then we don't even know where to start. So it's my job as a clinical therapist to start working through some of these challenges with people and making sense of it. But if you feel that, I just want to say that it's a good thing that you have something so raw and like right there front and center to work with. So please keep that in mind if you're feeling like any version of this isn't right, or why do I still feel this way, or this totally sucks. See it as an opportunity, like I like to call things as a transformation hotspot. It's this opportunity to take something that feels horrible and like alchemically work it to transform it into something that is your growth and your own transformation. So let's just talk about the situational aspect of IVF treatment. You need to think about yourself and the emotion, the rawness through the journey. You know, was it a range of different emotions, which is very likely? Was there many different times in which you had tried IVF treatment? Because the flavor of your first IVF kind of go round has a very different flavor than your fourth. There's been a whole dynamic of stuff and a lot of time, a lot of emotions, a lot of stress and strain on relationships, finances. All of these different things need to come into play because it's such a big topic that we all need to kind of get into and understand. So part of the emotional and energetic consideration for this video is to understand your situation and know that each set of treatment has its own story. The exact same way that I was talking today on an interview, that every single C-section, every single birth has its own story. So you need to almost like work with them individually. Not necessarily in a way that means like you got to take like all this extra time, but you got to treat each like section of time, each event, each kind of IVF go around as its own kind of experience and start to work that way. So you can get really clear around what kind of emotions are stored inside of that. Because when we have a scar, when we have those puncture wounds, what happens is we get all of that challenge, all the emotional energy, all the energetic energy lodged inside that, all those puncture wounds, and they don't move anywhere. Because as a general rule across the board, when you have scarring on your body, you stop giving it input, aka you stop breathing into it. You stop touching the area. Some women even stop looking at themselves in the mirror. So you lose all of this sensational awareness around the area, And that is something that needs to come back. It's something that needs to obviously so be worked around and brought back to life. So I want to bring all of that just up at the forefront. And then I want to also just talk about the three-part roadmap that I have because this area is kind of confusing. The emotional and the energy. Maybe it's not so confusing for IVF because it's so front and center, but nonetheless, the roadmap is really helpful. So I want to talk about these three different phases for you to start getting more attuned to and connecting to what you could be potentially working with. So the first phase is the before the IVF treatment, like before the whole thing started. What was your emotional experience? What was like the energetic signature of that time? What was going on in your mind? Relationship dynamics, finances in this situation, and in others, but particularly in this, we want to think about all of that emotion because all of that's going to be carried into the event itself. Okay, then there's the actual event, which in this situation is kind of like a longer one. A lot of the time we're talking about a single surgery, like a C-section, like I spoke about, or having like a tumor or some sort of cancerous cells removed. That's usually a one-time kind of event. It could be an accident. That's a one-time situation. We're talking about something very long or longer and extended. So you really want to grab the emotion of that whole period, which could be like the whole gamut. It could be every emotion under the sun, and that's okay. You just want to be real and really like bring that stuff back up to like your awareness, but bring that, like, let it bubble back up. Then you want to go to the after, everything that happened after the IVF treatment. And again, this is totally situational. Did it have a positive effect or not? If it didn't, that's going to have a completely different effect on the woman if it did not bring a conception baby into this world versus if it did. So you want to obviously consider this three-part roadmap to really start to get a sense of what kind of challenges is stuck up in that area. So that's really important to pay attention to. Now, what I want to go into here is the what to do section. So the what to do is how to begin working with this area. And I'm going to first give a three-part guided practice, which is what I give for all scars. And this is the exact same because, again, I want you to recognize that this area doesn't have to be a place of like raw, unprocessed challenge or a place of disconnect or a place that we no longer like about ourselves. So I'm getting like right in the sun here. I'm going to see if that's better. There we go. I want it to be an area where you recognize that there's a potential to transform, because when you can find something in the area, it's like you found your own little pot of gold that you have the opportunity to work with. Because if you have something to work with, then you're like already on your way. But like I was explaining earlier, if you don't know what's going on and you don't know how to begin, then you're confused and lost, and you need to, figure those things out at the very beginning, which is what a lot of therapists do. That's kind of the first range or like level of assessment that you do when you're with some sort of therapist. But here in the three-part practice, I'm giving you that opportunity to find all of this transformation potential just from this simple practice. So let's talk about that, and then what to do for IVF treatment in general as a preliminary step. So the three-part practice is 3 parts. The first part is relaxing into, which has just 4 simple things to remember. Find a place that you are comfortable in your home somewhere and give yourself time. Don't do this and then go right into a Zoom meeting, or don't do this and get right into your car and pick up your kids. Give yourself the space that you deserve to honor your body, honor your timeline, and really respect the whole process. Now, you want to lay or sit in whatever position is comfortable. You want to make sure that you're touching the area, touching the scarring. So you may have 2 hands on your abdomen, depending on, however you want to touch your body, 1 hand, however it works. Try to cover as much space as you can, because I know that the IVF treatment can be kind of a general area on both left and right side of the belly button. You really want to make that skin-to-skin contact in a meaningful way. You want to touch your body in a way that is so much more potent than just the way that you put on your makeup and brush your hair and put your clothes on. I want you to say something to yourself along the lines of, I'm about to explore an area of my body that feels really tender, like emotionally raw, or that I may have neglected for a long period of time because there was this hurt here. I want you to just bring that into your awareness, because that makes a really meaningful connection, almost like a closed circuit loop with your body, in that the sense of touch is a really powerful one to activate. So the fourth thing to do is to close your eyes. Close down the sense of sight, close your vision, so that also ramps up your sense of touch. It also helps you to just feel really safe and comfortable in your own little environment to set this practice up well. Now, the second thing you want to do, which is going to be interesting for an IVF treatment, most people don't really recognize, as some people are saying here, that they didn't recognize that the IVF treatment will be significant. So I want you to know that as you touch the area, as you're just generally feeling the area and gathering the physical considerations, which is the second place, know that you may be challenged to feel stuff at first. So my hands as a clinical therapist are very receptive to touch and feeling different parts of the body because I'm trained. But that doesn't mean that you can't learn the exact same skill. You just have to practice. You have to touch the area maybe once every day or once for a month, and you will start to build that relationship back with your body, which is so required when we're going through a transformation process. We want to reconnect back with every little nook and cranny of our body so that we can experience that fullness and that wholeness that we want to feel as women. So the physical considerations that I'm talking about, when you make contact, I want you to grab a sense of, is there areas of numbness all the way to like hypersensitivity? Just feel into that and just, figure out and get a sense for your own baseline, like where that numbness is, where that hypersensitivity is, as well as hot and cold. And another thing that's very common for this area is your own kind of almost like sympathetic experience when you touch the area. A lot of women feel nauseous, they feel aversion, they just feel this ickiness. A lot of this is a really common thing when you go in and touch your scars, particularly this one that has the high like emotionality to it. So all of those things in this phase, as well as you want to feel the physicality of the tissue. Do you feel like there's some areas that are not moving well, some areas that are stuck? So when I'm talking about scars that are more of a longer shape from like a surgery or an accident or something like that, those scars will always kind of groove and kind of weave themselves down to attach onto bone. Now, because the puncture wounds are quite small, it's probably not likely that they are doing that. That would be a little bit kind of exaggerated or maybe a little bit dramatic in my mind. However, you may still feel that there's like just connective tissue tightness. Like there could be feelings of tension, areas where the tissue does not move well, like in all directions, places of stuckness, places where it's being held. If you feel like around the bones, or maybe closer to your belly button, you may have a different sense of where it could be really stuck, because when you get towards bone, you can really feel if there is the potential for it latching onto somewhere nearby. So feel into that. That's the second consideration. And then the third is the emotion and the energy. Really gather that three-part roadmap that I was talking about. It's so important that we just spend this bit of time recognizing that there's something there to work with, because maybe we didn't even know that. Maybe we've been trying to work through the kind of challenge of the whole IVF journey from a different perspective. But now that you know that just by placing your hands there and the potential to move all of that stuck, stagnant energy is local, right where the activity was, that's a really good thing to know about yourself, because you know that you can start working that area to really start to fully resolve and process that whole event or events through. So that's the three-part practice I wanted to share with you. It's really about gathering information as a baseline. It's really about you recognizing that there's a potential for transformation here. Now, what to do with the IVF treatment in general as a preliminary step. So like I said just earlier, that it's a common thing across the board is wherever we have scarring, we'll have disconnect from the area. Like we will no longer be connected with our awareness, with sensation. It's almost like it's very common that it's like a black hole or like a void. A lot of women describe particularly the pelvis in this lower area as that. They can't put their mind there. It's almost just, it's like blurry and dark or gray or something like that. So when that's happening, we are no longer putting any other type of input there. So it's very likely that you're not breathing into the area. It's very likely that you're choosing to breathe somewhere else, maybe higher up in your abdomen, maybe the sides of your body, maybe really chesty. We know now there's just so much breathing research now that we know that if we're chest breathing, then we have a high probability of respiratory challenge, heart health problems, cardiovascular stuff. And maybe you've been trying to work on your breathing problems, but not really knowing the source. So this is all about finding the source of the problem and going towards that source, really working from that place for full resolution instead of not full resolution, because we're working the symptoms and not going to the origin. So the what I want you to do is really simple, and it's just going to start to breathe down, breathing down and into that place in your body. And what I want you to feel, just like we were talking about with that party balloon, that as you're breathing down into the area where the IVF treatment happened, I want you to feel like everything is moving in all dimensions, like you're giving a stretch in all directions, meaning you're not just pushing your abdomen forward and sucking it back in again. You're feeling like your pelvic floor is accepting your breath. With every inhale, there should be this opening, stretching, lengthening, creating some space kind of feeling that begins very low. A lot of women don't really breathe past their belly button or something even worse. So you want to take that inhale, preferably through the nose, down, almost like I like to imagine it like you're filling up a cup of water and your pelvic floor is the base of the cup. And you're taking that breath in and it fills from the base first and it starts to rise all the way up, as high as it feels like you can. And then your exhale is coming from the top first, exiting through the nose. And then the last thing to really relax and settle is very low, kind of in the pelvic floor area. It's very similar to yogic breath, if you know what that is, but in a really intentional way that starts to push all of that held tension, like all of that emotion that's stuck in there, all of that energetic like stuckness and stagnation there, just with your breath. This is a very respectful, gentle, kind, calm, slow, like progressive way to work with the area that is really, again, like an embodied process. It's really a down and in experience rather than a more commonly up and out kind of avoidance pattern. So that in itself can just be incredibly healing and powerful. So I think that is everything that I wanted to share inside this class today. If anyone has any questions, please let me know. I'm more than happy to talk about any of these topics. If you try out the practice and you have a question on like progression or it feels like this, what about that, then please just write it inside this thread. I'm very active inside this group and we'll see it all so that I can answer and continue to just nudge you along in your transformation process. But this is such an important topic. It's something that we're not really talking about, and I personally find like great, I feel really good about getting into these taboo topics that we're not really getting into publicly. So just to have a live and have a conversation about it and, have it here, please invite other women into this group so that they have access to this too, so that we can really bring this to light, because once we get the answers, we are already on our way to the solution. So you're very welcome. It was very nice to have you here. And I will see you very soon. I'm going to do one more live this week. So I'll see you then. Bye.